The Portland Hospital is the only private hospital in the UK which is specialised in offering paediatric, maternal, gynecological and breast care. Situated in Westminster, the hospital has 600 medical staff and around 45,000 young patients annually.
The Portland Hospital clearly demonstrates the characteristics of a firm in a capitalist economy, as various staff, including consultants, receptionists, nurses, etc., are employed in order to provide a service. These medical services are exchanged for money paid by patients, therefore clearly demonstrating supply, the provision of private healthcare, and demand, potential patients looking for private healthcare, in a free market firm.
Another basic issue that our group examined was whether the conditions of the market of specialized private healthcare services for women and children contribute to a dynamic capitalist economy. Even if the Portland Hospital provides services that can only be accessed by privileged people, underprivileged people through government provision and education can have access to such services and even become members of such hospitals. Nevertheless, the lack of competition and equal opportunities to healthcare and education leads to a less dynamic capitalist economy.
As well as private firms, government policy can greatly influence capitalist societies. Developmental states are nations where the government is able to incite economic growth through various policies like subsidies and investments, while still being capitalist societies. Since the Thatcher government, a wide range of previously state-run firms have been privatised, like railway companies and postal services. However, one fundamental service has remained a public firm since its founding in 1948 and continues to be a symbol of the importance of state provision.
The NHS funds many hospitals and healthcare systems around the UK. It has always been funded through taxation, so unlike its private counterparts like the Portland Hospital, patients who are, as the NHS website says, ordinarily resident in the UK are not required to pay any type of fee before or after receiving care. This NHS leaflet, issued in 1948, shows how the public provision of healthcare has closed the inequality gap greatly, as even those on the lowest incomes are able to access medical services whenever required.
It's commonly believed that the NHS is deprived by the private sector due to poaching of staff, but there are also other pressing issues that are contributing to NHS's hardship, such as an ageing workforce and pension policy. Removing private healthcare would impair the NHS's services, as they regularly make use of the treatments provided by private services, and in many cases healthcare professionals work in both independent hospitals and the NHS.
A great example of this is evident at the Royal Free Hospital, where the private department is wholly owned by the Royal Free London NHS Foundation Trust. Whilst increasing standards for private patients, the generated revenue from the unit goes towards funding and developing the NHS, indicative of the growing role private healthcare is playing on the standards of healthcare and inequality as a whole.